Hi everyone, it's Jessica again, and welcome to CritIC. In this series, you'll learn all about the workup to acute kidney injury. This video covers the part we often find most difficult, the renal causes of acute kidney injury. Let me break this down for you. Now, what do we mean with renal causes of acute kidney injury? We mean that the cause of a decrease in renal function is due to the kidney itself, meaning the nephron. Renal causes of acute injury can thus be subdivided into the subunits of the nephron: glomerular causes, tubular and interstitial causes, usually referred to as tubulointerstitial causes, and vascular causes. Tubulointerstitial causes are the most common, and as they comprise of only two subgroups, in my differential, I usually name them separately: acute tubular necrosis and tubular interstitial nephritis. So when going through renal causes in my differential, I go through glomerular, ATN, TIN, and vascular causes. Glomerular causes are usually some sort of glomerulonephritis, meaning inflammation of the glomerulus. This can either be infectious, post-infectious, typically post-streptococcal, or inflammatory, by which I mean some sort of autoimmune disease. There are 4 autoimmune-mediated rapidly progressive glomerulonephritis, RPGN, you need to remember, because the diseases can deteriorate rapidly and treatment, like plasmapheresis, must be initiated quickly. The first is ANCA-associated glomerulonephritis, previously called Wegener's disease, which is characterized by granulomatous inflammation in the kidneys and lungs and can thus cause pulmonary bleeding. The second is anti-GBM glomerulonephritis, previously called Goodpasture's disease, characterized by antibodies against the basement membrane in the lungs and kidneys, causing pulmonary bleeding. The third is atypical hemolytic uremic syndrome, usually caused by uncontrolled complement activation, causing thrombocytic microangiopathy and direct tissue damage. It thus has similar characteristics to TTP. And the fourth is lupus. All GNs have in common that they cause glomerular hematuria, meaning that dysmorphic red blood cells and red blood cell casts are present in urine. This means that if you see these in urine, you confirm the GN diagnosis, but if you don't see them, you can't exclude the diagnosis fully. Glomerular damage is furthermore characterized by proteinuria. Take-home message: perform a urinalysis. Acute tubular necrosis, or ATN, can be caused by 3 main things: ischemia, drugs, and deposits. Ischemia. The tubules of the kidneys are the most sensitive to hypoxemia, meaning that low flow states can cause ischemic damage quickly. This means that if you have a pre-renal injury untreated, it will progress into ATN. Examples of ischemia causing ATN are therefore shock, sepsis, severe dehydration, hypoxemia, etc. Drugs. Several drugs can have direct toxic effects on tubules. Don't worry, you'll be able to remember a lot of them by heart after a while. A few notable ones are aminoglycosides like gentamicin, NSAIDs, and iodine-containing contrast. Deposits. There are a couple of important substances that can jam up the renal tubules, causing direct tubular damage. Examples are casts in multiple myeloma, calcium phosphate, and calcium oxalate. Also remember that in conditions that cause rapid cell death, the contents of the cell spill out and can jog up the tubules. This happens in rhabdomyolysis and tumor lysis syndrome. ATN has a variable prognosis, depending on the severity and duration of the injury. Renal function can recover fully, partially, or not at all. It does take a lot longer than the recovery of pre-renal injury, weeks to months versus days. Tubulointerstitial nephritis, or TIN, is inflammation of the tubules or their surrounding interstitial space. This is either caused by an infection, a UTI, or by drugs that cause a local allergic reaction. Drugs to remember are antibiotics, especially beta-lactam antibiotics and quinolones, proton pump inhibitors, diuretics, and anti-seizure drugs. But there's a huge list. A urinalysis will help you here as well. It will show white blood cells. Nitrite may be positive in a UTI, as some bacteria produce nitrite. So perform that urinalysis. The last large group contains vascular causes, which can be subdivided into TMA, like HUS, vasculitis, the autoimmune kind, and thrombosis of the larger vessels. So that's my overview in a nutshell. I've left out a whole lot to keep it practical. Now, if you only remember one thing from this video, it's drugs, 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 and perform a urinalysis. In my next video, you'll learn how to integrate this newfound knowledge about acute kidney injury. See ya!